Hi guys, thank you so much for watching. Welcome back to my YouTube channel. It has been a while since I haven't had any video. I have been busy, guys. Anyway, welcome back. It's been so great to actually being able to film again. I miss filming and I miss talking to you guys, sharing and information, knowledge and all that. By the way, my name is Roselle Roth and I'm a nurse here in Las Vegas. For today's video, guys, it's going to be about, let's talk about STDs. As you all know, STDs is kind of scary thing if you think about it, right? When I was growing up, I used to live in a very small town and I didn't know anything about all this stuff, STDs. But so anyway, STDs is known as sexually transmitted disease, or it was also usually once called venereal disease. Basically, it means that the diseases that you can get that can be sexually transmitted. So first, we're gonna talk about the chlamydia. Chlamydia is a bacterial infection. Actually, it's caused by bacteria. So this is usually treatable with antibiotics if treated or diagnosed early. So this video is about actually just health awareness. It's to inform the public, it's to educate you guys, to help you guys prevent, or to help you guys be aware of the things, of symptoms, so that you could easily go to the doctor and have yourself checked out, especially to the third world countries, especially my home country, Philippines, which we are very unfortunate because we don't have a lot of, especially when you live like in a in a province where I used to live before, we really never had any type of education about these things, which I wish that teachers should actually include this in their curriculum so that everyone will be aware. It is very important. It's like a health awareness, right? So first off, guys, chlamydia is a bacterial infection. So usually it's treated when you first when you first recognize the symptoms, which is you will feel itching around, you will feel itchy around your private parts, around the anal, oral, your penis and vaginal area. You will be itching and all that. You will have second symptoms would be painful urination. It's basically just saying you're having, when you urinate, you'll have like it's painful, but you have to be careful because this will also mimic urinary tract infection, because so it's kind of like difficult sometimes to tell. You just have to make sure that you use your best judgment, because also painful urination can also mean you have a urinary tract infection. But you just have to kind of like combine it with other symptoms that you're experiencing. If you are itching around your private parts, or you have painful urination, and then for the male and female, if you have a discharge in your private area, especially yellowish discharge, so you kind of like, it will give you like an idea, right? Like, okay, something is wrong, I have to go check out, I have to go to the doctor and check it out. So just be aware of those symptoms. The next one is the so-called, I'm sure that everyone knows about this, the syphilis. It's still a bacterial infection, guys. Of course, it is spread through sexual contact with unprotected sex, especially for like the teenagers. Please make sure that you have like you use condoms and all that, or you use some kind of protection, because it's very hard. I mean, it's not easy to have all these diseases. Sometimes some of these diseases can actually cause other types of diseases like cancers, because there are some strains of STDs, virus that could potentially cause cervical cancers and oral cancers, cervical cancers down the road in the later future. So make sure that you do your research and make sure you get treated as early as you can. So anyway, chlamydia is still a bacterial infection, of course. Unprotected sex, if you have sex with many partners, or make sure that you are aware of that. Make sure that if you do that, make sure that you get tested every 6 months or a year, just to make sure, just to check. The next one is going to be, so we did syphilis, we did chlamydia, right? Gonorrhea is also a bacterial infection. It's another type of bacteria that causes an infection, a chlamydial infection, right? So these are also, it's dangerous also, because if you are pregnant, especially if you're pregnant, guys, and if you don't treat it because you don't recognize the symptoms early enough, you can pass it to your baby. You can actually, it will cause really a complication to your newborn. They could cause blindness to your newborn. It's not good for that. You don't want that to happen, right, to your unborn baby, and then when they were born, they're gonna get like blindness. So make sure that you know all that. I think that if the more you know about these diseases, it will help you prevent or find an option that you will get treated fast and early enough. So the next one, guys, is gonna be the HIV. So we all know HIV is a virus, and there's no cure for HIV. So it's really, really important. I'm gonna urge everyone that you guys need to be careful, especially because you can get HIV from, of course, sexual partners that has HIV, right? Or sexual contact without protection that has HIV. Or also you can get it, not all the time that you can get HIV from kissing someone, but if they have like sores in the mouth and you kiss them, they have like cuts, in the lips, you can get HIV because of the break, from the skin, So just be careful of that. There is no cure when you get HIV, but there are medications that it can manage, and especially for today's technology here, especially here in the United States, we're very advanced. So there are a lot of people that have lived for like 20-30 years living with HIV and did not develop into AIDS, because if you don't treat or manage the symptoms of HIV, it can develop into later it could develop into the worst stage, which is the AIDS, acquired immune deficiency syndrome, which causes you to be sick. It causes you to have less immunity, and you're gonna get sicker and sicker, and potentially death. So yeah, I'm not trying to scare you, but this is just an information that you guys need to know, that we need to know in order for us to prevent from getting the sickness. HIV is also, you can get it from sharing needles. A lot of people that using drugs, people, for example, there's a lot of that uses here, like if they're homeless, they use drugs and they don't know because they're not aware of what it can do to them. They share needles. So what happens that in the long run, they get HIV because of the shared needles. Also, for example, for nurses, for healthcare providers, be careful when you take care of patients that, just in general, be cautious. Just treat everybody as they're sick. Use standard precautions, use universal precautions. When you're dealing with needles, use it properly, be careful with it, use it and put it away in the sharps, discard it in the sharps container, because not all the time that it will be placed in the patient's history and physical what they have. It may not be there because they want it. Sometimes if they want it private, they don't have to put it under H&P, right? I have an experience like 10 years ago. I thought I was going to die, actually, because it was an accident. I was injecting on my patient, one of my patient with, and it was like an insulin flexipen. I was injecting him. It dropped. I removed the needle from the flexipen, and then it dropped into my, like, this left palm here. I was really, oh my, I was really I was so sad. I was depressed. I didn't want to tell anyone. I waited until like 4 p.m. and I told my supervisor, and just like, you need to go to the clinic and have, you know, you need to be checked in, and so that they can check you out and treat you right away to prevent it. The reason why it's important to have you you know, get in the clinic and start that treatment regimen right away, because you want to keep that you know, that virus from forming into your blood. So with that being said, you need that you need to take medications right away to prevent that from forming. So the first thing I did was I washed my hands very well. It was really tiny needle, and I spoke with my infectious disease at that time. He said that for that tiny needle, it only is, there was like 0.003% of me contacting the disease. But luckily I went there right away, and then they gave me like 3 types of medications. That's actually that particular patient was taking. I was taking it for a month, and then they kept testing me for like every month, and then every 3 months, and then every year for like 2 years. Luckily it was good, right? It was really, I was so happy. But it was, when it happens to you, it's really depressing, because you're gonna feel like, oh my god, I'm gonna get sick, you know, I'm gonna die. But no, it's not really. I mean, it's, but you still have to be careful. Accident happens, you know. It was like really an accident. But I just want to make sure that don't be overwhelmed when it happens, you know. Just know that, you know, there are treatments out there, that you will be okay. But I know how it feels. It was really the worst feeling ever, that when that happened to me. Anyway guys, just be careful, okay? Because there are no cure for HIV, there are no cure for AIDS, just medications are just to manage, but eventually your body will give out, your body will not can be able to take this medication. So just be careful. Yeah, so and the next one guys, the last but not the least, I'm gonna talk about syphilis. Syphilis is still a, you know, bacterial infection, right? The first sign you would notice is that you would have a sore in around your lip, around your anus or vagina, or like bumps and all this. And then after that, you will still weak, sore, you know, rashes. You'll have a lot of rashes. The sore will become into like, you know, multiple rashes, and if it's not treated. So be aware, and you know, if you notice something unusual within your body, within your private parts, around your mouth, you know, like I said, painful urination, itching around the area. What else? Discharge, unusual discharge of your private parts. Make sure that you go to the doctor, you check it out and see, so that, because the sooner the better. It's actually, it will get treated early, it's better. There are more chances that you're gonna, you know, you're gonna be better and get resolved, and you know. So just be aware of that. Like I said, I just want to inform the public and be aware. I just wish that on my time, you know, there were like people actually that do this kind of stuff, that educate you, because not everyone is a nurse, right? And not everyone has an access to an internet, that like back home where I used to live, there was nothing. We were not educated of anything like this. So please like and subscribe. I'm gonna end it here guys. Please like and subscribe, please share my video, and please hit the notification bell down below, so that you will be updated of my new videos. By the way, it's been so nice to be, you know, back filming again. I just was really busy. But anyway guys, please let me know if you have any questions, about health and stuff like that, to make you more aware, and what to do, you know, to prevent it from happening, or you know. And if it happens to you, it's okay, you know. There's just seek treatment, you know. I mean, there's always going to be treatment. And like when I was the accident happened to me with the needle with the patient HIV. Yeah, I'm okay. I just have to take like a month of medication and that's it. But still, we have to be very, very careful if we can, right? Anyway, guys, thank you so much for watching, and I will see you in my next video. Bye.